Hi, I'm Dr. Amjad Furniturewala, and we are now talking about glaucoma, a silent thief which gradually, painlessly and effortlessly robs the patient of their normal vision. What is glaucoma? Well, glaucoma is a condition that causes damage to your optic nerves, and it gets worse over time. It's often linked to a built-up of pressure inside your eye. Glaucoma tends to be an inheritance disease and may not show up until later in life. The increased pressure, called the intraocular pressure, can damage the optic nerve, which transmits images to your brain. And if the damage continues, glaucoma can lead to permanent vision loss. So in short, without treatment, glaucoma can cause total permanent blindness within a few years. Well, if you are above 40 years and have a family history of the disease, you should get a complete eye examination from an eye doctor every year. What causes glaucoma? Well, it's a result of high fluid pressure inside your eye. And why does the pressure increase inside your eye? This happens when the liquid in front of the eye doesn't circulate the way it should be. Normally, the fluid called aqueous humor flows out of your eye through a mesh-like channel which is called as the trabecular meshwork. If this channel gets blocked, that liquid has nowhere to go and it starts building up. That's what causes the raised intraocular pressure, and that's what technically the condition known as glaucoma. When you talk about glaucoma, you're talking about two variants. You're talking about an open angle glaucoma, you're talking about a closed angle glaucoma. Now, what's an open angle glaucoma? Well, it's the most common type. Your doctor may also call it as a wide angle glaucoma. The drain structure, which is the trabecular meshwork, which we just spoke about, looks normal, but the fluid doesn't flow out the way it should be. What happens in an angle closure glaucoma? Here, there's an angle between the cornea, the transparent portion of your eye, and the brown tissue, which is the iris. Now, the fluid has to drain through this angle into the trabecular meshwork and out of the eye. When this angle is very narrow, the fluid drainage is affected, and that's the reason the fluid starts getting accumulated, raises your intraocular pressure, and eventually the same condition we spoke about, glaucoma. So this is known as an angle closure glaucoma. Who gets glaucoma? It mostly affects adults over 40, but young adults and children and even infants can have it. You're more likely to get it if you are above 40, you have a family history of glaucoma, have a poor vision, have diabetes. Because of certain systemic condition, if you are taking steroids, if you had a trauma, an injury to the eye, which has damaged the angle or the natural trabecular meshwork. Apart from this, you can have it inborn in a child, which is known as a congenital glaucoma, and many more reasons. Now, what are the symptoms? As a patient, what do you expect? When do you feel I'm a candidate for glaucoma? Well, honestly speaking, most people don't have any symptoms. They may just come to an eye doctor, an eye hospital, they walk in and then the intraocular pressures are checked, or maybe the fundus is checked, or maybe the peripheral vision is checked with some instrumentation. The plausibility of glaucoma becomes obvious. I have heard in my earlier days people talking it about as a heart attack of the eye. What happened? The patient suddenly talks about loss of vision, a red eye, and severe pain, headache, associated with vomiting at times, appearance of halos. If you have any of the following symptoms, immediately seek medical care. Seeing halos around lights, vision loss, redness in the eye that looks hazy, particularly in children, nausea, vomiting, eye pain, narrowed vision, tunnel vision. These symptoms immediately should take you to an eye care professional. As an eye doctor, I would advise every patient to go in for an annual eye checkup. It not only rules out a glaucomatous condition, but many more conditions. Well, how is it diagnosed? The doctor is going to do a lot of tests. Primarily, the first thing is you check your vision, both for distance and near. Then a tonometry is done. What is tonometry? Tonometry is a procedure in which you check the pressure of your eye. Okay, having a normal pressure doesn't rule out glaucoma. The next test is you need to have a dilated examination of your eyes where the optic nerve head is checked, because in glaucoma all you get is a damage to your optic nerve head. Now, what's perimetry? Perimetry is a test which subjectively helps us in figuring out what is the pattern loss of peripheral vision. Perimetry is a tool where the patient keeps the chin in, looks at different stimuli which may be a little in the periphery, figures out where he can see them, he doesn't see them, and whenever he doesn't see, the machine tracks those areas and we can see the loss of vision in the periphery. Well, how do you treat? You have a patient, now you've diagnosed, you've done your investigations, now you want to go in for the treatment because that remains the mainstay. In most conditions, it's simple as prescribing an eye drops. Yes, you have to use the medication for the rest of your life. I remember having told 9 out of 10 patients not to forget putting eye drops. Well, they can afford to forget a meal, but don't forget to put an eye drops in your eye once or twice daily as prescribed. There may be times when eye drops are not sufficient and you may be needing a laser surgery. Laser surgery has been very effective in glaucoma treatment. What does laser surgery do? This procedure slightly increases the flow of the fluid from the eye for people with open angle glaucoma. It can stop fluid blockage if you have an angle closure glaucoma. Procedures include trabeculoplasty, which opens the drainage area, iridotomy, cyclophotocoagulation. Procedures include trabeculoplasty, which opens up the drainage area, and in worst case, we even need an implant. Now, what is a trabeculoplasty or trabeculectomy? Trabeculectomy is a procedure in which the doctor creates a new channel to drain the fluid and ease the eye pressure. There may be times the doctor may use an implant or a tube to help drain the fluid. So talk to your doctor to find out which glaucoma treatment is right for you. Early detection and early treatment is the key to glaucoma management. See your eye doctor once a year. See healthy, live healthy.